In the heart of Harlem, New York City, a sudden and alarming cluster of Legionnaires' disease cases has sparked urgent concern among residents and health officials alike. This vibrant neighborhood, known for its rich history and cultural significance, now finds itself at the center of a public health emergency that is drawing citywide and even national attention. As of August 6, 2025, the outbreak has claimed the lives of 2 individuals, while at least 58 others have fallen ill. Hospitals in the area are on high alert, with emergency rooms seeing a surge in patients presenting with symptoms consistent with Legionnaire's disease, such as high fever, cough, and shortness of breath. The outbreak began in late July, and since then, the number of reported cases has risen rapidly, demonstrating just how quickly Legionnaires can spread in a densely populated urban environment. The summer heat, combined with the city's aging infrastructure, has created conditions where the bacteria can thrive and multiply. Health officials are working around the clock to trace the source of the outbreak and contain its spread. They are urging Harlem residents to stay alert, follow public health guidance, and report any symptoms immediately. Community meetings and press conferences are being held to keep the public informed and to answer questions from concerned citizens. Legionella bacteria, the cause of Legionnaire's disease, thrive in building water systems, especially in large, complex structures like those found throughout New York City. Cooling towers, hot water tanks, and plumbing systems can all become breeding grounds, turning everyday infrastructure into a potential threat if not properly maintained. The investigation is currently focused on several specific Harlem zip codes where the majority of cases have been reported. Acting Health Commissioner Dr. Michelle Morse has been at the forefront of the response, urging anyone experiencing symptoms, such as fever, chills, muscle aches, or difficulty breathing, to seek medical care without delay. City workers are inspecting cooling towers and water systems in the affected areas, searching for any signs of contamination. Notices have been posted in buildings, and residents are being advised to take precautions such as avoiding showers that produce mist and reporting any maintenance issues immediately. Unlike many infectious diseases, Legionnaires is not spread from person to person. Instead, it is contracted by inhaling water droplets contaminated with Legionella bacteria, making the identification of the environmental source absolutely critical to stopping the outbreak. Public health teams are distributing information about the disease and its symptoms, emphasizing that early recognition and treatment are key. Community outreach is underway, with health workers visiting homes and clinics to educate residents and answer their questions. The coming days are crucial. Investigators are racing against time to halt the spread, protect the community, and provide care for those already affected. Harlem's resilience and cooperation will be vital in overcoming this public health challenge. Legionnaire's disease is a severe, sometimes fatal pneumonia caused by Legionella bacteria. These bacteria are common in nature, but become dangerous when they multiply in man-made water systems. Outbreaks occur when contaminated water is aerosolized, turning a harmless microbe into a public health threat. Legionnaires is not contagious. You can't catch it from another person. Infection happens by inhaling contaminated water droplets, not through direct contact. The bacteria thrive in warm, stagnant water, like that found in large plumbing systems, cooling towers, and fountains. These systems can create invisible mist that people unknowingly breathe in. The key to prevention is environmental control, not isolation. Understanding this pathway is essential for effective public health response. Early recognition of Legionnaire's disease is vital for recovery. Symptoms often mimic the flu: high fever, chills, headache, and muscle aches. As it progresses, a cough, sometimes with mucus or blood, shortness of breath, and chest pain develop. Some patients also experience nausea, vomiting, diarrhea, or confusion, especially older adults. These symptoms, combined with recent exposure in Harlem, should prompt immediate medical attention. Don't dismiss it as a simple cold or flu. Tell your doctor about your location and the outbreak. Quick diagnosis and treatment can be life-saving. While anyone can get Legionnaire's disease, some are at much higher risk. People over 50, smokers, and those with chronic lung conditions are especially vulnerable. A weakened immune system, due to illness or medications, also increases risk. Cancer patients, transplant recipients, and those with diabetes or kidney failure should be extra cautious. Healthy younger people usually recover quickly, but severe cases and deaths are most common in high-risk groups. Public health alerts focus on these populations for a reason. If you or a loved one in a high-risk group develops symptoms, seek care immediately. Early action is critical for the best outcome. Legionnaires' disease spreads through water, not person-to-person contact. Infection occurs when people inhale mist contaminated with Legionella, often from cooling towers, fountains, or hot tubs. Cooling towers, used in large buildings' air conditioning, are frequent culprits, dispersing bacteria-laden vapor over wide areas. Other sources include decorative fountains, misters, and poorly maintained plumbing systems. Even home humidifiers can be risky if not cleaned properly. Legionella thrives in warm, stagnant water and biofilm inside pipes. The bacteria's journey from natural water into building systems, multiplying, then aerosolized for people to breathe in. This invisible path can turn a rooftop cooling tower into a city-wide health threat. Understanding these roots is key to prevention. In the heart of New York City, health officials are racing against the clock. An urgent investigation is now underway to halt the rapidly spreading outbreak in Harlem. The stakes are high, and every moment counts as teams mobilize across the city, determined to protect the health and safety of thousands of residents. Specialized teams, equipped with protective gear and advanced testing kits, are meticulously inspecting cooling towers throughout the affected neighborhoods. Their mission? To identify any traces of Legionella bacteria that could be lurking in the city's vast network of water systems. So far, 11 cooling towers have tested positive for Legionella, prompting immediate and thorough cleaning and disinfection. Crews work around the clock, scrubbing and sanitizing equipment to prevent further spread of the bacteria. The health department is closely supervising every step of the remediation process, ensuring that all contaminated sites are treated with the utmost care. Inspectors monitor water treatment procedures, double-checking that no detail is overlooked in the fight to eliminate the bacteria. Meanwhile, public outreach efforts are in full swing. Community health workers are distributing flyers and information, while digital warning signs alert residents to the risks. People are urged to stay informed, recognize symptoms like fever, cough, or shortness of breath, and seek medical care immediately if they feel unwell. Acting Health Commissioner Dr. Michelle Morse is leading the response, providing regular updates and clear guidance to the public and the media. Her leadership is helping to coordinate the city's efforts and reassure concerned New Yorkers. All of these actions are guided by hard-earned lessons from previous outbreaks, as well as strict city regulations that govern the maintenance of cooling towers. Regular inspections and rigorous protocols are now more important than ever. Investigators are also reviewing compliance records and maintenance logs, working closely with building managers to identify any lapses that could have contributed to the outbreak. Their goal is not only to stop the current crisis, but to prevent future incidents from occurring. The city's rapid and coordinated response is essential to breaking the chain of transmission. With every department working together, New York is determined to contain the outbreak and protect its communities from further harm. The good news, Legionnaire's disease is treatable with prompt medical care. Early diagnosis and antibiotics like azithromycin or levofloxacin greatly improve recovery chances. Rapid tests, such as the urinary antigen test, help doctors confirm the disease quickly. Delays in diagnosis can lead to severe complications, including respiratory failure or septic shock. Don't wait. If you have symptoms and a possible exposure, advocate for yourself and mention Legionnaires to your doctor. Quick action bridges the gap between suspicion and life-saving treatment. Knowing your risk factors and symptoms empowers you to protect your health. Early intervention turns a potentially fatal illness into a manageable one. Awareness is your strongest tool. Legionnaire's disease was first identified after a mysterious and alarming outbreak in July 1976 at the Bellevue Stratford Hotel in Philadelphia, where thousands of American Legion members had gathered for their annual convention. What began as a routine event quickly turned into a public health crisis as attendees started falling ill with a severe form of pneumonia that doctors had never seen before. The suddenness and severity of the illness caused widespread fear and confusion, both among the public and the medical community. Over 200 people became sick, and more than 30 tragically lost their lives. Investigators worked tirelessly, examining every possible cause from viruses to toxins, but the answer eluded them for months. It wasn't until January 1977 that scientists finally identified a previously unknown bacterium, Legionella pneumophila, as the culprit behind the outbreak. This discovery marked a turning point in the understanding of infectious diseases. The source of the infection was traced to the hotel's cooling tower, which had released contaminated water vapor into the air. As guests and passers-by inhaled the mist, they unknowingly breathed in the dangerous bacteria, leading to the rapid spread of illness. This event was a wake-up call, revealing how modern building systems like air conditioning and ventilation could inadvertently transmit deadly diseases, especially in densely populated urban environments. Since that time, Legionnaire's disease has become a recognized global health issue, with outbreaks reported in cities around the world. New York City, in particular, has faced several major incidents, each one drawing renewed attention to the risks posed by contaminated water systems. The 2015 outbreak in the South Bronx was especially significant, infecting over 120 people and resulting in 12 deaths. In response, city officials enacted strict regulations on the maintenance and inspection of cooling towers to prevent future tragedies. Despite these efforts, New York continues to report thousands of cases in recent years, highlighting the persistent and ongoing risk that Legionnaire's disease poses to public health. These events underscore the importance of vigilance, strong regulation, and rapid response from public health authorities. Regular inspections, public awareness, and swift action are essential to protect communities from future outbreaks. The history of Legionnaire's disease serves as a powerful reminder of why robust public health measures matter and how they can save lives when new threats emerge. To protect yourself, stay alert for symptoms, especially if you're in a high-risk group or live in affected areas. If you feel unwell, contact your healthcare provider and mention possible Legionnaire's exposure. Keep home water devices, humidifiers, CPAP machines, fountains, clean and disinfected. Follow manufacturer instructions to prevent bacterial growth. Stay informed through official sources like the NYC Department of Health website. Avoid misinformation and trust updates from public health officials. New York's strict regulations and rapid response are designed to prevent and contain outbreaks. The public's role: know the symptoms, seek care promptly, and support community health efforts. Together, vigilance and action will help bring this outbreak to an end.